Distinguished speaker, I represent of Ibu Director of Public Health Nutrition. Apologize that Ibu Dhian have to attend the other meeting. And about the malnutrition problem situation, I want to share only one slide. Yeah. I hope all of you can see the slide. Is the slide already can see?
Yes, Ibu.
Okay. Thank you. About malnutrition problem situation, actually Indonesia is currently experiencing the double burden. The proportion of stunting you can see in the slide. Stunting among children under 5 nationally based on the survey in 2019 is currently 27.7%, wasting 10.2%, and underweight 17.7%. On the other side, we are faced on increasing of overnutrition in under 5 children and adults. And it is known that 8% of children under 5 also overweight. And in the micronutrient problem, 1 in 5 pregnant women had anemia, and about 18.4% adolescent girl also anemia. And we already found that only 38.1% pregnant mothers consume iron folate acid tablet with sufficient quantity. In Indonesia, we can say it's sufficient if it's more than 90 tablets. It's only 38.1% pregnant women consume more than 90 tablets. It means that there are still many women who do not understand the importance of consuming IFA, and this closely related to the need of strengthened nutrition education, of course. And after this, sorry. Okay, and this is our framework of multisectoral intervention to reduce stunting. We have already the national strategy to accelerate stunting prevention in 2018 and 2024. This is the prioritized. We have two interventions, the specific and sensitive. The specific intervention are carried out by the health sector, and the sensitive intervention are carried out through various activities outside the health sector. Maybe that what I can share.
Thank you very much for the opportunity. I thank FANS as well as the Southeast Asia Public Health Nutrition Network, and especially dear friend Professor Hadin Shah for this opportunity. And I'm glad to represent the India's Nutrition Society as well as the premier research institute under the Ministry of Health, which is the National Institute of Nutrition, which is a 101-year-old institute. We've just completed our centenary. And thank you so much. And we've been at the forefront of the nation's fight against the problems of nutrition, and nutritionally empowering the nation through various of our activities, including research. Yeah, as regards the problem statement about the prevalence of stunting and specific problems like anemia in India, we are yet to reach a large milestone of reducing anemia and things like that. But before I tell you about the Poshan Abhiyan, which is the Prime Minister's scheme that has been launched in 2018 to combat the problems with a huge ambitious targets of reducing stunting, anemia, and other nutritional issues. Let me tell you, as Professor Hadin Shah has rightly pointed, India is also in the stage of nutrition transition, wherein we have the triple burden. Gone are the days when India is only known for undernutrition. Now we are also rapidly contributing. That's a sad state, but rapidly contributing to the global obesity epidemic, which is globesity, along with a lot of problems of non-communicable diseases. But as regards stunting, yes, the National Family Health Survey 4 of 2015-16 shows that there is a reduction in stunting a bit from 48% in earlier survey to 38.4, but stunting is still a huge problem in Indian context. Wasting is about 21%, but the under 5 deaths due to wasting in India are very low as compared to the global average. That is one thing that needs to be looked at. And anemia, yes, among children who are less than 5 years old, anemia is very high. It was as high as about 69% in the previous round of survey, but the current round shows about 58.4. And similarly, the pregnant women who are anemic are more than 50%, which is a very, very, a situation which needs important schemes to be targeted at. And while talking about the Poshan Abhiyan, which is the flagship program, which stands for Poshan in Hindi means nutrition, but Poshan is an acronym for Prime Minister's overarching strategy for health and nutrition. Poshan Abhiyan is a movement. So Poshan Abhiyan is the Prime Minister's program, and then the target of Poshan Abhiyan is that it aims to reduce stunting in children of 0 to 6 years by 2% per annum by 2021, and we intend to reach a 6% reduction in the next 1 or 2 years. And preventing and reducing undernutrition among children of 0 to 6 years, the target is again reducing 2% per annum. Similarly, anemia among children is aimed to be targeted at 3% per annum. And the prevalence of anemia among women and adolescent girls, especially, is targeted to be reduced at 3% per annum. And in total, the low birth weight is expected to be reduced at 2% per annum. The targets are ambitious, but the beauty of Poshan Abhiyan is that it talks about convergence and making nutrition a public movement. There is a concept called Jan Andolan. Jan means people, Andolan means movement. Nutrition as a people's movement, and it lays great emphasis on providing nutrition awareness, education, and also communication. And at the same time, it looks at convergence as an important tool. Convergence, which I mean, is that it clearly understands and highlights the factor that ensuring good nutrition to the people is not just about telling people or educating people alone, but bringing about convergence of many sectors and stakeholders, which in fact are necessary for improving the nutrition status. So the convergence between ministries from top level to the grassroots level, convergence between the local functionaries of each of the ministries, including women and child development, including health, including road transport, including civil supplies, including food and agriculture. So all these sectors have to come together. So Poshan Abhiyan clearly envisages convergence happening between among all these various ministries, right from grassroots level to the ministerial level at the top of the governance
Thank you.
of India.
Thank
So
you,
this is in brief.
Dr. Thank you,
Thank
Dr. Gavaravarapu.
Thank you.
Sorry, because we
Okay, can you see my PowerPoint right now?
not yet. It's
Not.
your folder, but please press the PowerPoint.
Okay. Can you see right now?
Not yet.
You should be. I think you can see right now.
Have you opened it, your
Yes.
PowerPoint?
But
No. Okay. Yeah,
okay.
it's coming. Yes.
Right. Yeah. Hi. Very good afternoon to all of you. I'm very happy to and truly excited to see some of the friends, colleagues for this interesting webinar on the discussions on how we can end the anemia and stunting for the healthy Asians. And I would like to take this opportunity to thank specifically to the Food and Nutrition Society of Indonesia for your kind invitation for me to join some of the perspective that happened in Malaysia. So again, I was given the task to discuss about current problem and the programs for controlling the stunting and anemia for the Malaysian perspective. And my name is Leng Huat. I'm from the Program of Nutrition and Dietetics from the School of Health Sciences, Universiti, Sains, Malaysia. So the out of my today's sharing, I will begin with some of the magnitude of the problem in Malaysia, based on the several population-based study conducted, and followed by the discussion of some of the potential causes of malnutrition risk. And lastly, we'll try to say some of the overview of main initiative, program, and activity that has been carried out by the Ministry of Health under the Nutrition Divisions with the partnership of several relevant ministries, such as Ministry of Education, Ministry of Women, Family and Community Development, in order to control the nutritional related anemia and the undernutrition risk among pregnant women and young children. And just for your information, for this particular sharing, and the whole credit is not solely belong to me, and whereby I also would like to get this credit to the Ministry of Health in particularly, and also some of the relevant education authority by sharing their thought and the view when I'm preparing for this particular slide. So now we move on, and many have acknowledged and agreed that the development of undernutrition risk among the young children can be categorized by 3 different conditions, namely the stunting, wasting, and underweight. And for today's discussion, I will only focus on the stunting risk that have been considered as a chronic undernutrition that we all are quite aware that is affecting our young children in the Southeast Asian and also to some other regions throughout the world, as highlighted by the previous speaker. And let me say some of the current findings to whether or not Malaysians should and also need to be pay attention on this problem compared with our counterpart in the other country in Southeast Asia and as well as other regions of Asia as a whole. Now, and there are many local studies has been conducted to assess the problem and the factor associated with the undernutrition risk in Malaysia. However, for today's session, I will just focus on several nationwide population-based data, such as National Health and Mobility Survey, carried out throughout the Malaysia in 2006 and 2016, as I already presented to you in this particular slide, in which the information pertaining to the nutritional status assessment has been conducted among the children under 5 years of age. And the first National Health and Mobility Survey conducted in 2006 reported that the period of stunting among children under 5 years, defined as by height for age less than -2 standard deviation from the median of the World Health Organization child growth standard, was about 17.2%.
Dr. Fu, you only have 2 minutes left.
Oh,
yeah,
so fast.
please.
Okay, again, you can see from 2016, again, the period is about 20.7. And however, in the recent study conducted by the UNICEF, again, it's 22%, which highlighting to us that it's about 1/5 of Malaysian children are having the stunting problem. Okay, now I move on a little bit faster. When you compare with the study between the age group from the 2 and 4 years old, and you can see that the stunting risk as indicated by the red and yellow color is about higher compared to the 2-year children. And again, that for the anemia in pregnant women, and based on the National Health and Mobility Survey, is about 29%. However, when we try to look up into the risk factor, and you can see that the older women from 45 to 49 years old, the single unmarried women, that is referred to the younger adolescent pregnancy, and the low socioeconomic group tend to have a higher anemia during the pregnancy. And now again, the causes is almost same like what that we have known a lot. Now, I just would like to say about the key strategy that has been implemented to control the undernutrition among the mother and children. As you can see from here, one of the very important key nutrition policy relating to the mother and children is a national framework to address the food and nutrition challenges in Malaysia with the aim to achieve the optimal nutrition and general well-being of Malaysia. And again, there are many nutrition program and activity has been focused among the population across the lifespan. However, for today, I will just highlighting some of the program and activity has been conducted by the Ministry of Health specifically for women and the children. As you can see from here, for the pregnant woman and infant, and this is a several activity has been conducted, And again, when you are talking about the nutrition education activity, and this is a few activity has been highlighted in the blue color, which is a nutrition education for mother, nutrition counseling for pregnant and lactating women, breastfeeding promotion program, baby-friendly hospital initiative in the hospital, and as well as for the community clinic, and the cooking demonstration on diet for mother and infant, and supplementary feeding program for those who are having undernutrition during a pregnancy, and lastly, the anemia prevention program. And this is my last slide. And for the children up to the school age children, and there are several activities has been undergoing for this particular programs from 2006 to 2025, nutrition surveillance committee rehabilitation program for malnourished children that has been specifically to those who are having the stunting problem, that is mainly focused on the indigenous population children, and community rehabilitation program for children with a special need, and the school feeding programs, and also the school meal program. And I hope that I have covered the problem and also some of the program that has been undertaken by the Ministry of Health and also the Ministry of Education in tackling the undernutrition and the anemia among the mother and young children. With that, thank you very much.
So I'm going to talk about it at a very general level, more of a global level, and really just talk about the problem of malnutrition. I'm going to focus on the problem of undernutrition specifically, but I do recognize the problem of overnutrition and the growing problem there. I'm also going to talk about the prevalence of undernutrition very generally, and about what types of programs can be implemented and scaled to prevent problems such as maternal and child stunting and anemia. I think you probably all know that undernutrition, specifically conditions such as maternal and child stunting and anemia, have both short and long-term negative health consequences. For example, maternal and child stunting and anemia increase the risk of things like morbidity, mortality, disability, but also things like poor cognitive development in children, poor reproductive performance, poor birth outcomes, and even poor adult functioning and economic performance. So I wanted just to talk about a little bit who's at highest risk. So stunting and anemia disproportionately affects women and young children, especially during the first 1,000 days of life, which is a period between conception to the age of 2 years, when rapid growth and development is occurring. So if conditions like anemia and stunting occur during this critical period, they are more likely to impair or have short and long-term health and development consequences, negative consequences. In fact, we know that the pre-pregnancy and the pregnancy environment and the environment in infancy and early childhood interacts with the child's genetic blueprint for growth and development, setting children on different trajectories that will impact their lifelong health, their cognition, their academic potential, and ultimately their productivity and earnings as adults. So I think quite simply, the quality, all understand, of the early nutrition environment plays a really important role in shaping a child's future potential. Children, for example, who are exposed to optimal maternal nutrition in utero are often born healthy and of normal weight, and are more likely to follow a healthy developmental trajectory across the lifespan, leading to better health, functioning, and earning as adults. Where on the other hand, children exposed to a poor maternal nutrition environment, such as maternal stunting or anemia in utero, often are born unhealthy or small, and are more likely to follow a suboptimal developmental trajectory across the lifespan, leading to chronic health problems and limited economic potential. So I just wanted to talk just briefly also about what programs can be scaled or implemented and scaled to prevent maternal and child stunting and anemia. The prevention, I think, of maternal and child anemia and stunting, it's really important that the prevention is as early as possible and starts ideally in the preconception period or earlier in adolescence. It's also important to do things like optimize antenatal care services to include frequent antenatal care visits, to include early ultrasounds, to include counseling on healthy diet and optimal infant and young child feeding behaviors such as breastfeeding and complementary feeding, and to do this not through just education and transfer of knowledge, but also by implementing social and behavior change communication strategies to really help people change their behaviors, improve their behaviors. Also, other interventions that can help promote optimal maternal and child nutrition include prenatal micronutrient supplementation, either with iron, folic acid, or multiple micronutrient supplements during pregnancy. The multiple micronutrient supplements in particular have been shown recently through some scientific trials to prevent poor pregnancy outcomes such as low birth weight, small for gestational age, and things like stillbirth, even above and beyond what iron folic acid does. And also multiple micronutrient supplements also have the potential to prevent things like child wasting and child stunting. Another intervention that's critical during kind of the prenatal period is the provision of balanced energy and protein dietary supplements in undernourished populations. Also the provision of calcium supplements in undernourished pregnant populations. And then finally, again, I think the provision of social behavior change communication strategies, really to try to promote the uptake and adherence of all these things, like uptake and adherence to antenatal care services, uptake and adherence to prenatal supplementation or calcium supplementation, and also uptake and adherence to a healthy diet or to the use of optimal infant and young child feeding behaviors. All that is really important, but changing behaviors is actually quite challenging. And I think a lot of work needs to be done around that area to figure out how to best promote maternal and child nutrition. Thank you.
Thank you so much. And thank you very much to IFANS and the organizers of this seminar for giving me the opportunity to join this very esteemed panel in my first week in Indonesia. I'm very pleased to be coming back to Indonesia after about 10 years away from Jakarta. So it's nice to pulang rumah Jakarta. Also, thank you for the kind acknowledgement on WFP's World Peace Prize. We are absolutely humbled to receive the Peace Prize and honored that this discussion brings onto the global agenda the importance of zero hunger. And of course, further motivates us and mobilizes communities around the world to help us work on this, including here in Indonesia. I'll give a bit more of a global perspective, but also try to bring it back to what my colleagues or what the fellow panelists have already spoken about from Malaysia, India, and Indonesia. I think what is fascinating to hear from the panel so far, and what is a consistent and strong message, is that the solution to the reduction of stunting and the reduction of anemia is clearly a multi-sectoral approach. We heard in the beginning from Indonesia, of course, that they have that the plan is based on a multi-sectoral platform. It's not only considered a health issue, and I think this is quite important when we're talking about stunting and anemia and what we can do to improve the situation for populations globally as well, and specifically in Indonesia. Where we see high rates of anemia and stunting, we also typically see a food system that does not deliver or does not provide access consistently to affordable, diverse foods for everyone. Sometimes in Indonesia, for example, we see that although some people might be able to afford a healthy and nutritious diet, the cost of a healthy, nutritious diet, one which would provide the essential nutrients to prevent stunting and anemia, are often out of reach of a vast majority of many in the population. So as I was saying, I think sustainable change really requires this multi-sector approach with integrated programs that address the different driving factors of stunting and anemia. So But in order to be able to do that, we also really need to understand what the situation is in a particular context. What are the rates of various different micronutrient deficiencies, and what are the driving factors behind that? So for example, things like what are the dietary norms in a particular context, within a culture, within a specific population? How are these dietary norms and what individuals consume and choose to consume and what caregivers choose to feed their children? How is that influenced by gender, cultural, and social norms? We also must always be thinking about not only from a food intake perspective or what you can access in the market, but keeping in mind things like hygiene and sanitation. Again, much of that being driven by culture and social norms. And then what are the other driving factors that influence access to affordable, healthy diets? What is happening within the private sector, within the marketplace, within the agricultural sector that determines what individuals have access to? And of course, as my previous colleague previous panel member just mentioned, there is the absolute criticality of the health system. And in places where we see high rates of anemia and stunting, we also typically see a health system which is inequitable, where we don't have sufficient access for large parts of the population to those very important prenatal health services and to information. In this context, or in any context, we need to carefully consider what are the different levers that we can pull. What are the different points that we can push on to improve nutrition status or to see a decline in anemia? Is it more about getting access to micronutrient supplementation? Is fortification, things such as rice fortification, is that a potential option for increasing micronutrient intake? All this to say that we really do need a combination of a nutrition specific and a nutrition sensitive approach. And so I was quite pleased to hear that our first panelists discuss that as part of the Indonesian plan. And of course, today we've also come together to talk about social behavior change and communication. And so I'll save my comments on that for the next round of questions. One thing that, and I'll just end with a bit where I started, that we really do need to have better data, information, and an understanding of the context in order to come up with the most context-specific appropriate policies and programs and plans. And here in Indonesia, WFP is embarking on a process called Fill the Nutrient Gap, which will be working together with the Ministry of Health and many other stakeholders across Indonesia. And that will really give us the opportunity to understand what is it that's driving nutrition and driving the nutrition status in Indonesia, and how can we come together as key stakeholders to find solutions based on good analysis and data. Thanks, everyone. I'll stop here.